I'm going to now demonstrate the difference between a flat knit compression garment and a circular knit compression garment. You can have a flat knit compression garment for the leg or the arm. Today we're demonstrating with the arm, but just so you know, you can also have a flat knit garment for the leg. So the very first thing we're going to do is we're going to put on our hand sanitizer. Make sure our hands are clean. It's very important when you're putting on a flat knit compression garment that you're wearing donning gloves. But for PPE, you're going to put on your gloves first before you put on your donning gloves. So every client should have a pair of donning gloves. And for your own protection, you're going to have these on inside these gloves. So this is a flat knit compression garment. This is the red one. When we were telling you the difference between the flat knit and the circular knit garment, the previous garment was blue. This is red because it is the color that this client has chosen. You can get them in multiple colors, and they are custom fit to the client. So this client chose red. She wanted it to be nice and vibrant, so this is the red one. But it's the same material as the blue garment. They're both flat knit. And just to show you here, this is a circular knit compression garment. It's a much thinner material. You can also have it for the arm or the leg, but they serve different purposes. And that will be up to the prescriber and the physician. So to put on a flat knit compression garment, you're going to want to pull it inside out. Okay. I'm going to take her arm here. Now the seam has to go towards the pinky here. Get nice and close. So I'm going to push this on, and it is tougher to put on, but they do wonders for the client once they are on. So you're going to get the client to push into you. You're going to keep a nice straight back. And push, 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 push. Good. Now we did that because we want to get the wrist in place as much as possible to make your life easier. Then you're going to put her arm, or his arm, right into your armpit. From here, you can pull it up. Now whatever you do, you don't want to pull, just start yanking at the top, because you will cause a hole in the garment. It's happened before. So just like pantyhose, where you wouldn't just start yanking at the top because you'd cause a run, you're going to work it up. Now her shoulder might get sore, so you might just hold it in your armpit. Now, put her arm on top of you, because you got to get this top part of her arm. Especially when you're dealing with someone who might have some loose skin at the top here. That loose skin needs to be tucked in. So I'm going to grab some more material. And this is where, when you have the gloves, you can slide against like this to help get the garment in place. That gives me a little bit more material at the top. And now I can tuck in any loose skin. Make sure it's nice and flat. We don't want it rolling at the top. That will cause a tourniquet and not allow fluid to flow upwards into her trunk. It's very important at the end that you're doing a check. You want the garment as far up into her armpit as possible. We have no loose skin in the armpit. There's a little triangle here at the elbow, and that is right at the elbow joint. The garment actually has a sewn triangle to indicate that it's in the right spot. And the garment shouldn't be going into her hand. It should be stopping right at the wrist. Is it comfortable? Can you move your arm?
Feels good.
And that's it. Now in removing the garment here, we're just gonna literally pull a little bit here, but we don't wanna, because it's so tight, we gotta be a little careful. Putting her arm right into your armpit inside will help take the fatigue away from her shoulder. You can use her hand to leverage a bit. There you go. And then you can turn it inside back to the normal way it should be. And that's it.